and individuals who actually make this college a great place to work. Today we have a couple of invited guests that are here to share some information regarding the district's transition into the Calpers health plan. The first speaker who will come up is Chica White, and she will discuss exactly how the program works, what you can expect, and enrollment. I am going to ask everyone, out of respect of our speakers, so she can stay on time and also on track with the information that she needs to provide us, is that you hold your questions till the end. I will be passing out cards. If you have a question, write legibly so I can read your question out. If I can't read it and I don't remember who gave it to me, I'm sorry. I may have to not read the question because I don't want to misrepresent anyone in the room. But I will be passing cards out. If you have a question and you're ready to give it, just raise your hand and I will come by and pick up the card. This session will be recorded. We're recording this session for those of us who have colleagues out there, faculty and staff, that are unable to make this session or the sessions tomorrow, which will be at Vallejo and Vacaville. In the morning, we'll have 9 to 12 in Vallejo and then 2 to 5 in Vacaville. So if you're attending this session and you feel that you need to attend another because you just want to make sure that you get the information correct, feel free to attend the sessions tomorrow. Okay, so with that, I'm going to pass the mic to Ms. White. And if you can join me as a district to welcome Ms. White. Yes, sir. Oh, yes, I'm going to pass them out. Thank you.
Thank you, everybody. Hi, my name is Chica Managa White. I'm with Calpers. I'm just going to give you a brief background, and then I'll go into some things you guys need to know about eligibility of your dependents and who can and cannot enroll. Calpers has nearly 50 years in the business of providing health benefits. We have over 1.3 million members. That gives us more flexibility with negotiating our rates and due to the large risk pool and the amount of people in it. I'm going to explain to you how it works because I've gotten several questions about Calpers, the health plan. Calpers is the program, and we offer 2 separate HMOs and 1 PPO. The PPO provider is Anthem Blue Cross. They are the administrator of the PERS Care, PERS Select, and PERS Choice plans. Out here in Solano County, PERS Care and PERS Choice are your only options. PERS Select is not available. The other plans are HMO. We have Blue Shield Access Plus, Blue Shield Net Value. The only difference between the two is the physicians available in each network, and then we also have the Kaiser HMO plan. So I hope that clears it up a little bit as far as Calpers, the program, PERS PPO plans, Kaiser HMO, and Blue Shield HMO. All those plans are available to you except, again, for the Blue Shield Net Value and the PERS Select plan. Okay. The next thing I want to talk about is the dependents that are eligible for coverage. Your spouses are eligible, your domestic partners, your natural step or adopted children. Your children are covered up until the age of 26. Your certified disabled children are covered up to forever, as long as they were certified disabled before the age of 26. We have a questionnaire available. I think you can see the HR staff for those if you need any, and I might have a few if you need some of those too. We also recognize dependents in a parent-child relationship. So for instance, if you're a grandparent and you're taking care of a grandchild, you can add that person. The district has whatever requirements they might ask for, tax documents or receipts or proof that you are that person's parent and acting as their parent. But we do provide options for you to cover your dependents in a parent-child relationship. And the last thing I want to talk about is when you're enrolling, remember that if you are a dependent on somebody else's Calpers plan, let's say you have a spouse who's a subscriber through another school district that's in Calpers, you have to decide whether you want to stay on that person's plan and you have your own if you want to stay on that person's plan, or if you want to have your own separate one and that person be separate, or if you both want to move to Calpers. You can't both have separate subscriptions and claim each other as dependents. That's dual coverage and we don't allow it. Also, if you have 5 children and you also have a spouse who's on Calpers plan, those 5 children need to be on that spouse's plan or yours. You can't put 3 children on one enrollment and 2 on the other. They all have to be on the same enrollment. And that's all I have. We're available for questions at the end of all this. I'm going to introduce Layla Hastings with Blue Shield, and she'll talk to you about those plans. Thank you.
Thank you, Chica. Hi, everyone. Good afternoon. My name is Layla Hastings, and I'm the account manager with Blue Shield of California. Thank you so much for coming out today. We are set up over here on the right-hand, well, my right-hand side, with a table, and the table has brochures that you can come up and pick up. I only brought a certain amount of directories with me, so if you are in need of one, the quickest way to get one is to download one from our website. But if you're used to having paper copies, I can take your name and number and perhaps mail them out to you. The copies that I did bring, I brought the big, gigantic book that covers all of Northern California, but then I also made up copies of the just Solano County area. So don't panic if you don't see your physicians listed in the paper copies, because it's only for Solano County. So if you have a physician in Alameda or Contra Costa, it's not going to be listed in this book. Okay, so Blue Shield offers 2 different plans. We have the Access Plus HMO plan, which covers a lot of our medical groups, and then we have a narrow network plan that's called Net Value that is also available to our Calpers members, but it's only limited to certain counties. So this plan is available in Contra Costa, Sacramento, Yolo, San Francisco, San Joaquin counties, and the rest of the counties are listed in the brochure. How many of you live outside of Solano County in one of the counties that I mentioned? Okay, just a few of you. So if you wanted, you could choose the Net Value plan and pick one of the physicians within that network and have a lower premium. But the majority of us are going to access our Access Plus plan. So let's talk about that one. So really, on both plans, the benefits are exactly the same. The only difference is going to be the service areas and the providers. So with Access Plus, as you know, in Solano County, you're going to have access to John Muir Health, North Bay, Sutter, Hill Physicians, and in Alameda counties, you're going to have Alta Bates, and some of the other ones that you're used to. But for your copays, it's going to be simple. $15 copays for your doctor visits and specialist visits. All your preventative services are going to be at no copay. And what I mean by preventative is if I go to my yearly annual exam, that's going to be $0. If I go and get labs or x-rays, that's considered preventative. It's going to be $0 copays at the doctor's office. Now, Blue Shield offers a unique feature called Access Plus Specialist, and it's kind of like a mouthful. And I can self-refer to a specialist within my own medical group, bypass the primary care physician, and pay a $30 copay for that first initial consultation. Once that specialist needs to treat me continually, then I'm going to pay a regular $15 copay. So that's a unique feature to the Blue Shield HMO plan. And once again, you're going to self-refer to a specialist on our plan if you wanted to bypass the primary care physician and pay that $30 copay. So you're just saving essentially another appointment. If I need to go to the emergency room and I do not get admitted, I'm going to have a $50 copay. If I go to the urgent care, I'm only going to pay a $15 visit for that. This year we have a new feature with Teladoc. Has anyone ever heard about Teladoc before? Okay, this is a new service that we're offering all our Blue Shield members for 2012. Essentially, Teladoc is going to be a number that you call to speak to a physician and get treatment over the phone for like sinus infections, a bronchitis, UTIs, and they can actually prescribe you a prescription over the phone in case your doctor's office is closed. What members need to do first is set up their medical history. So they would go onto the website, set up their medical history online, and then they can call anytime for free and get treatment. Okay, let's talk about prescriptions. So on our plan, the generic prescriptions are going to be $5. The brand medications are $20, and the non-formulary are going to be $50. And that's for a 30-day supply at the retail pharmacy. So if I'm taking a maintenance medication, and do you all know what maintenance medications are? Yeah? Okay. Like a blood pressure or cholesterol medication, something that you have to take on a daily basis, or could be birth control as well. You are going to want to look at our mail order program because you're going to get a 90-day supply for the price of 2 copays. So essentially, you know, if I'm taking a maintenance medication and I want the 90-day supply, I'll go through our Prime Mail and I'll pay $10 for that 90-day supply. And then it's $40 for the brand and it's $100 for the non-formulary. So Blue Shield has its own formulary, and you can get a copy of that on our website. So that lists all the medications that are in the plan, and it does classify them as generic, brand, or non-formulary. That way you know what you are going to pay. We offer several different discounts to massage therapy, chiropractic services, and acupuncture. So if you picked up the Be Well and Save, that lists what the discount is. It's a 25% discount to those types of services. And then you can find participating providers on our website. We also offer gym memberships at a discounted rate, and discounts to Weight Watchers, and different vision services. We have a registered nurse that you can also talk to at 2 o'clock in the morning when you all of a sudden wake up with a severe stomach ache or an earache and you're not sure. She can help you. And I'm calling her she just because I want to. It could be a he. At any rate, it's a really great service, and it saves you a copay, but then also kind of helps you figure out if you do really need to go to the emergency room or not. So that's available to you. And lastly, I want to tell you about our Life Referrals 24/7. This is like an extended EAP program. So essentially you can get free counseling sessions. You can get 3 every 6 months to a mental health provider. And then we also offer counseling over the phone for services like legal advice, financial advice. If you are dealing with trying to figure out, how to manage an elderly parent that may need to transition into assisted living, they can assist with that as well. And then I'm saving the best for last. Healthy Lifestyle Rewards. Our members get paid to live better and create healthier habits. And this program is called Healthy Lifestyle Rewards. It's powered by WebMD. And essentially all our members can go onto the Blue Shield website under Healthy Lifestyle Rewards, take a wellness assessment. It's going to assess your overall current health and flag any potential health risks that your current lifestyle can attribute to. So once you're done with the assessment, it'll say, okay, Layla, you need to work on nutrition and exercise. And then it's going to give me the programs and tools to be able to improve that and manage it. But not only that, it's going to reward me. By taking that assessment, I'm going to earn 12 credits I can redeem for a $50 Visa card. And I can use this Visa card anywhere. Each week that I log onto the website, I'm going to earn a credit. Every 12 credits earned, that's another $50. So essentially, I can earn up to $200 per year. So since you guys are not going to be joining us until July 1st, you're going to be able to earn $150 this year, and then next year when it renews again, January 1, you'll be able to start right away and then earn the full $200. Anyone on this plan over the age of 18 can also do it and get their own $200. So if I have a spouse and a child on my plan over the age of 18, they can, it could be like up to $600 per year. So it's really wonderful. We just want you to be engaged in your health. We're just more than an insurance company. We worry about all of you. So prevention is really important, And you know, we're living longer these days, and so we want to make sure that we're well and active. I think I'm going to invite Steve to come on up with Kaiser, and I believe Chica said we'll do questions at the end, so if you have any questions for me, we'll take those then.
And for those of you who just entered the room, if you do not have a white card to write questions down, just raise your hand and I will come around and make sure that you have an opportunity to ask questions by giving you a card.
All right, I have a good crowd here. How are we doing back there? Can you guys hear me? Yes, okay. I've always wanted to ask that. Hey, how up in the balcony somewhere, how are we doing? Ah! All right, well, I'm a pacer, so I'll have to give this guy some work to do. I'm Steve, and I'm with Kaiser, and I'm happy to be here today, and hopefully we'll give you an informative yet entertaining presentation today about some of the changes. And when we hear about changes, we all get a little squeamish, right? Changes, I don't like change. And so let's go over just real fast to get those things out of the way. What's changing at FIF Kaiser? Well, those that currently have Kaiser, take a deep breath, exhale, relax, because not much is actually going to change. Same number, same doctor, same hospital, same medical record, same everything. Two things. Your doctor visit, same thing, $15 copay. I think you guys had a $5 or $0 before. So a $15 copay. Next is going to be the pharmacy. So it's similar to a Blue Shield. So it's $5 for a 30-day supply. And I think before it was 5 or 0, but you could get whatever you guys needed. So now it's going to be $5 for a generic 30-day supply or 20 for brand. And you would buy those in those increments. Yet, if you use, and I'll little trusty handout here, on the table, I'll kind of show you what we have in the back, so don't get up now, you can get it after. This single green sheet is about our mail order system. So kind of like the sale, buy two, get one free. If you go anything over 60-day supply, meaning 90 or maintenance medication for 100-day, you can get a 100-day supply for $10, essentially 2 copays versus 3 and some change. So if that doesn't make sense, we are at school, so we can go back to math class again. So $5 for 30 days. But if you were lazy, you wanted to walk downstairs and wait in line for a half hour, you could get 90 days for $15 or go home and on your iPhone now, or on your way home with your safe Bluetooth, you can call up and order it over the phone and get it for $10 versus $15. So, speaking of iPhones, just last week we launched the iPhone official app for Kaiser. You can email your doctor, refill prescriptions. You can make appointments, change them over the iPhone now. That's crazy. And Android. So, who here has ever emailed their doctor? Awesome. That's money back in your pocket, you guys. You save an office visit. Or, in fact, what I heard this last time, someone said, hey, you know what? I have a pretty good rapport with my doctor. I've had him for a few years. He or she knows me pretty well. And so if I ever feel like something's just not clicking, whatever's not working, I can email them, and they can just give me a referral over the email. It'll be waiting for me. I can go to and see my specialist that way. Save an office visit that way. So, good stuff there. The most important thing you guys can grab in the back is going to be this brochure here. Okay, so flip the switch. And in there's a benefit summary. Calpers has a great little thing that they mailed out, but it has all the health plans. If you want to find out just about Kaiser, you can read this one. In the middle, it goes over the basic copays, things like that, what I just mentioned. So grab one of those on your way out, or on your way in, if you're still piling. So let's talk about Kaiser real fast. Those of you that have Kaiser, it's good to have a nice refresher. Those that might be looking into a change, let me tell you really why you would enjoy Kaiser. These are all great health plans, but we do things a little bit different. And I always start by telling a little bit of a story. I spent 2 years on a church mission in Poland. That was some cold winters. And so, but being there, I kind of missed home sometimes. Right? Being away from home for 2 years, not coming home. And I missed American food. I like to eat, and I like my food, and I like my fast food, and I like McDonald's. And so they actually had one there in Poland. And I got a Big Mac one time, and it tasted the same. as it did in Roseville, California, where I am from. Funny of that, right? So they have this system where wherever you go, and you go to McDonald's, it's the same way. It's kind of like Kaiser. You can be seen at any Kaiser facility nationwide that we have. So we're in Ohio, Georgia, Maryland, D.C., and up in Portland and the Washington area. We're also in Colorado, there we go, and Hawaii. So when you're in Hawaii, you can be seen there. And it's the same service. It's the same. You walk in, and they pull your chart. No, they don't, right? What do? They look you up on the electronic medical record. And that's how we keep track of things. And so everything's done through our electronic medical record. Thank you. And that's how we do that. Did you guys know that for $5 you can walk into any Kaiser, okay? Go to the member services desk, and for $5 you can get a flash drive provided to you with your medical record on that. Lock it up in the safe, or when you're traveling, because you just never know what's going to happen. That's something that's kind of brand new. $5 at the hospital. That's kind of good. Again, we want to give you guys the power back into your hands. We don't want to be dealing with insurance companies and that kind of. That's just gross. So put the power back into your fingertips. So, and we do that with our online health tools, such as emailing your doctor, mobile apps, calling up, so you guys are not in the hospital for very long. We're called an integrated healthcare system because everything's under one roof. So you show up, you park your car one time, hopefully relatively close. If not, you can thrive from the back parking lot. And then you go inside and you see your doctor, pay your $15 copay. But before you leave, they're going to grab your arm and say, hold on, ma'am, you haven't, I'm looking at your record here online, you haven't got your mammogram yet this year. So they're going to actually walk you down the hallway to our walk-in mammogram facility. And you can walk in, ladies, and get those done. No appointment needed, okay? Or that's, of course, you can get that after you go downstairs, which is nice, and get your x-ray or do your blood test. It's all under one roof. Again, it's all about convenience, saving you time, money, stress. I'm all about saving those things. A fun way to also de-stress is not by dropping things, but by looking at our local community outreach, our programs and classes. I have a catalog for local gear facilities, things that we offer at our hospitals, such as stress management, nutrition classes for the family, caring for an older parent, things like that you can attend for free or for nominal costs as a Kaiser member, but also for non-Kaiser members as well. Okay. So just in closing, we're just trying to give you guys the peace of mind that you guys can have a health carrier that gives you that convenience to be able to do things at your pace, at one location. But if you're to be traveling somewhere, that you know that you're covered. No matter where you are worldwide, whether you're on a cruise ship, whether you're in England, or whether you're down in Australia. We're talking about Australia surfing, okay, in Perth, one of the most remote places. And something happens, you can be seen anywhere worldwide, okay? That's Kaiser. I'm Steve Clegg, and this is Mark Johnson with Anthem Blue Cross.
Get on you, Mike. I'm not Australian, despite the socks. That's the one gift I get from my in-laws every year. I get one pair of socks, and they're always a big hint, like, why don't you move here? I'm Mark Johnson from Anthem Blue Cross. I'm involved in the management of these 3 PPO plans. These are a little bit different, other than the fact it's PPO coverage versus HMO, which in the health group world is like an apple to orange. These are self-funded plans. These are plans that are financially operated by the organization Calpers themselves. They are on the risk. They make all the financial decisions, the benefit decisions, premium decisions. They pay us at Anthem Blue Cross to be the claims administrator for the medical benefits. So we pay the claims, answer the phone, provide the network, have a medical department, and so forth. And then CVS Caremark is their PBM, Pharmacy Benefits Management Company, and they provide the pharmacy benefits administration role. So we work together, Anthem Blue Cross and Caremark. There are 3 plans that are offered in the Calpers system on PPO coverage. Now let me get real precise on these. Don't even consider PERS care. Just erase that from your mind for consideration. It's way too expensive and it's not a good value. I mean, I'm just being perfectly frank. PERS Select, and let me throw that out as well, because it's not eligible for enrollment in Solano County. There are 3 of the 58 counties in California where PERS Select is not available. Solano is one of them, as is Alameda County, and where I live, Placer County. And you may say, why is that so? Well, because only hospitals in those 3 counties tend to be very, very expensive. So this is a plan, if you live in another county, that you can get the same benefit coverage as by far the most popular of the 3 plans, PERS Choice, but you work with a smaller network of physicians and a smaller network of hospitals. That's why the premium cost is 15% lower. So I think for most of you that want or are interested in PPO coverage, the plan you want to think about is PERS Choice. PERS Choice has about 85% of all the enrollment for PPO coverage in the entire Calpers health system. I don't know if you know this or not, but Calpers is the 2nd largest purchaser of health care in the United States. So there are 360,000 members plus that have either PERS Choice, PERS Select, or PERS Care coverage. And some of those people are over 65 supplement to Medicare enrollees. PERS Choice is a conventional PPO plan. So there are certain benefit levels on PERS Choice that are HMO-like, in that you pay a flat copayment for an office visit, $20. Even if you decide you want to be seen by the say the head of the Department of Neurosurgery at UCSF, you can do so. It's $20. Your annual preventive care, your annual checkup, mammograms, pap smears. If you're at the age where it's appropriate for you to get your first colonoscopy, I had one last year, yeah? Those aren't cheap, by the way. There's over $3,000 easy for those charges. But if it's appropriate for you to have your first one, which is usually at the age of 50 or so, that's covered 100% under that preventive benefit. And then your medications, your prescriptions are also, you pay co-payments for those. Obviously, you pay less for generic, you pay more for brand. You have retail and mail order. And those are not subject to the $500 deductible either. So a PPO plan, it will always cost you more money to be enrolled in a PPO plan when you have medical services than an HMO plan. Always. It's just the nature of the beast. It's like you want the car with the 8-cylinder engine, you know you're going to get less gas mileage. So if you're interested in PPO coverage, you have to ask yourself a basic question. Am I willing to share more in plan expenses when I receive medical services with a PPO plan than an HMO plan? 4, this is the big thing about PPO coverage, for the unrestricted ability to pick and choose who I go to, and I have direct access to the absolute best medical practitioners. That could be hospitals, that could be specialists. You want to go to the Mayo Clinic in Arizona, you want to go to the UCLA Medical Center. There are no restrictions at all. That's why a PPO plan, you have to share more in the plan expenses, because your ability, flexibility, portability, and freedom to pick providers is unrestricted. Now, unfortunately, my family, we've had a lot of medical issues, and the one thing I've learned is that not all doctors are equal, right? There are some doctors who you wouldn't want to have your canary bee get medical services from. There are some doctors that are average, there's some doctors that are better than average, and there's some doctors who are absolute the cream of the crop. These are the doctors that other doctors go to. Doctors always know who the best doctors are. So if you torture them, they will tell you. But this is what this plan allows you to do. So the ability to get and find the best medical services you can get only maximizes your ability to have a healthy outcome. And that's why you're paying more. Not on the premium cost. If you look at the premium cost for PERS Choice, it's very competitive. You know, at most employer groups, either private or public, PPO plans, usually premium-wise, cost a lot of money. Way more than HMO. But in the Calpers environment, the PERS Choice plan premiums are very competitive. Now the other thing about with the PERS Choice plan is, let me explain to you how the benefit coverage works. So I talked about the $20 office copay, the 100% preventive, the prescription drug coverage. Those are not subject to the $500 annual deductible. So let's say you have a really healthy year and you just see the doctor twice. Once for an ear infection, and one's because you think you got bronchitis. It's going to cost you $20 each visit. They'll probably write you a script. You'll probably pay $5 for a generic antibiotic or whatever. You go in for your annual physical, that's 100%. So you don't even get into the realm of that $500 deductible. But let me give you an example of how the $500 deductible would come into play. Let's say you're enrolled in the first choice plan and you decide you want to see a dermatologist. Let's say you have a growth on your arm that you want to get checked out. It's $20 to see a dermatologist. If you want to, if you can schedule it, no restrictions, you can see the head of the dermatology department at Stanford if you want to. $20 to see that specialist. Now, in the course of doing the examination, the dermatologist may say, yes, that's something we should remove. Make a schedule, come back in the office in a week or two, and I will remove it here in the office. Come back in a week or two, it's another $20 for an office visit. Now, the actual removal of that growth, and they'll send it to a pathology. Let's say the total charges are $500. You would pay the entire $500. Now, at that point, you've met your deductible for the year. It's an annual deductible. Now, as a result of the pathology, they find out there's cancerous cells in that sample. So now you're going to start chemotherapy and all the other nasty stuff when you're diagnosed with cancer. Now you've met your $500 deductible, and the plan converts to 80-20 coverage. Now you go to participating providers. It doesn't matter if it's a hospital, doctor, lab, whatever. We've negotiated a pretty hefty discount, usually around 40%. So you're paying 20%, that's your share. The plan pays 80% of a fee that's already been reduced 40%. Now, getting chemotherapy, you're going to run into pretty big expenses. Or other big expense items like if you needed quadruple bypass, or somebody here, a young mother had a premature child, and you're getting some really big expenses. Your 20% is capped per calendar year at $3,000. I'm not saying that's a small sum of money. Obviously, with an HMO, it would be 100%. Keep that in mind. But if you have a major illness or injury, you know there's a reasonable cap on your out-of-pocket expenses. Your co-payments, the $500 deductible, and the $3,000 per calendar year. And this assumes you're going to participating providers across the board. Now, we have over 60,000 participating physicians in California, so it's really easy. We have all the major medical groups, Sutter, John Muir, Mount Diablo, North Bay. We have them all. Nice thing about the first choice plan is totally portable. So wherever you are in the United States, it works exactly the same way in all the other 49 states as it does here locally, or any county in California. The only thing if you're out of state, in fact, I'll tell you for a fact that virtually every retiree who's under age 65, or any retiree who's outside California is in the first choice plan. Same benefits, they just may be in Washington State, and they'll use the Blue Cross Blue Shield of Washington's network, or Blue Cross Blue Shield of Oregon network if they're in Oregon, or the same if they're in Kentucky or Alabama or whatever. So it's very portable, and it has worldwide coverage too. Not just for emergency care, but even for urgent care or something that's non-urgent. Just to say you're in Europe for a couple months and you just want to get a checkup because you've been feeling poorly. That actually would be covered. There's actually about 350 people in the first choice coverage. They're called expatriates, I suppose, that's the term. And they live outside of the country, in Mexico, Costa Rica, whatever. So again, pivotal question is, we've got the network, we're really big, it's a very flexible plan, very portable. Are you willing, are you in the economic position to pay out more in sharing plan expenses under a PPO plan than an HMO, to have the ability to go where you want and see the absolute best providers without any barriers, hoops to jump through? That's what it boils down to. Now, on the prescription drug coverage side, it's CVS Caremark. You know of them. The contract with probably 88% of all the pharmacies in the state. So it's more than just CVS pharmacies that are available. It also includes Walgreens, Rite Aid, all those other guys, Costco, Walmart. They have, like everybody else, they try to encourage you to get your maintenance medications through mail order. You get a 90-day supply. You do the math, it works out great. And they have a very comprehensive program there. They'll have probably a very slightly different formulary of drugs than your whatever current prescription drug administrator you're currently using. For the most part, they tend to duplicate one another, but there's some subtle differences. So there's a means for you to check those out. So are there any questions for me? I will be over here to answer some questions one-on-one. Yes?
So the maximum out-of-pocket per year is 3,000 or is it 3,500?
It would be co-payments and a 500 deductible and the 3,000, assuming you use participating providers across the board. You can go to non-participating providers. If you have PPO coverage right now, it works the same way, but the coverage level drops. And given how big our network is, you really don't need to go to a non-participating provider. Any other questions? Yes, back here.
I'm sure I know the answer to this question, but that's the copay, the $500 and $3,000 per person covered on policy.
Is per individual, and actually Calpers is designed a plan to give family coverage a financial break. So it's $1,000 deductible per family unit and $6,000 on the out-of-pocket on that 20% portion, and it's done on an aggregate basis. So if you have a large family, everybody can contribute a little bit toward that maximum cost.
Have these copays and the maximum deductible, have these things changed much over the last, say, 10 years?
Funny you should ask that. I'm the only person left at Anthem Blue Cross who started out managing these plans in 1999. So I know very well. They have not changed the deductible level or the 80-20 since February 2001. They've made only a couple subtle differences in the prescription drug copays, but by and large, the main benefit framework of the plans has stayed unchanged since February 2001. I mean, it used to be years ago that the average deductible for a PPO plan was maybe $100. Well, about 7 years ago, it was about $250. $500 is kind of average now.
See, where the thinking is that, you know, are we looking at a situation where these things will slide upward over time? We're kind of losing control of our own budgeting.
Well, no, I understand your point. Despite their size, Calpers is not immune to the same cost increases that every other purchaser of group health coverage has. You know, there's a lot of Calpers' members are state unions. So there's always a lot of pressure not to touch the benefits. There's no guarantees. I think the track record kind of speaks for itself. And 500 deductible, I don't even think they would go beyond that because that's pretty competitive right now. But going beyond 500, I don't see them doing that. The one thing about Calpers, though, over the years, just their size makes them a little bit more stable from year to year with the premium increases. It's like death taxes and higher healthcare costs. It's kind of like the new part of the equation. Yes, back here.
We have another plan with my husband has a plan. So is that $500 deductible if you have another health plan, does that cancel it out?
They still have to meet the deductible. Now, where it's beneficial, if you have two coverages, it will pick up the 20% portion if you're hospitalized or have a major surgery.
But it won't pick up the
No.
500?
No.
So could you explain to me how does it get to 6,000 if you only have a 500 per like there are 4 people in your family? That's $2,000. How does it get to the 6,000 max out of pocket?
Well,
I don't get it.
that's on that 20% portion.
Oh.
So, yeah, not the deductible. So let's say you had a large family and you were going up to Tahoe to play in the snow and the car went off the highway and you had broken limbs and internal injuries and whatnot. You could have the 2 adults that by themselves could each hit the 3,000. Bam, and the whole family's done. Because your kids could have injuries as well. I'm not trying to get gory, it's just trying to make a point. Does that make sense?
Absolutely. Thank you.
Okay.
I just want a little clarification that if for my individual, when I reach the $500 deductible, after that, every bill I receive, I pay 20% of the bill. Am I correct?
That's correct, if they're participating providers.
So,
Participating providers.
okay, every bill I receive from that on, I pay 20%
You'll pay
of it.
20%, and then the computer is tracking how much you're paying on that 20% portion. And once your 20% is hit 3,000, the computer knows it, red flag goes up, and then bam, it starts paying 100%.
Who pays 100%? The carrier, okay.
We do.
Thank you.
Okay, I'll be over here.
Well, actually, Mark, I'm going to ask you if you could stay there if Steve and Layla and Chika can come up front. And we have some other questions now. If you do have additional questions, you have the experts right in front of you. Please take advantage of this opportunity to ask questions. If your questions are not related to the plan, Calpers, or any of the plans, I will answer your questions after the fact. I want to make sure that we're respectful of the individuals that have been invited here to provide information and resources to make this transition smooth. The first question is, does Calpers Kaiser cover everything which our current Kaiser covers?
The question is, yeah, so the same services, just the co-pays change sometimes, but for the most part, it's going to be the exact same coverage. I believe that's what the question asked. Does it cover everything? The question is yes. So the one thing I didn't know if you had before, there is no chiropractic care as a true benefit. So if you were going to your chiropractor and paying a copay, that we don't have copay coverage under the active basic plan. But other than that, though, everything would be the same. Just the copays might be different.
Please explain how premiums are paid and why paperwork indicates that employee pays through payroll deduction. Again, the question is, please explain how premiums are paid and why paperwork indicates that employee pays through payroll deduction.
CalPERS is going to bill the district the full premium, and then they're going to deduct it from your paychecks. I hope that answers that question.
The audience said no.
Why?
Hold on. Please don't, I want to get this.
It's deducted on the employer side.
I'm sorry?
It will deduct it from the employer side, not the employee side, because it's an employer pay.
Well, CalPERS is going to bill the district.
Yes.
We're going to send them a bill
Yes.
for the total premium,
Yeah.
and then they're going to collect it back from you.
The district is only collected from the employer side, has nothing to do with employee. Employee doesn't pay, the district pay. It will show on your paycheck just like you currently receive it when you look at your check stub. It's an employer pay. Okay, it's not employee pay. Yes. The district pay.
The district
Okay.
pays
It's
and
the
they
same
don't
thing
bill us
like what
back.
you have now when you look at your check stub. It's not employee pay.
Okay. I don't think that spot likes me.
So why is the paperwork saying that we're going to pay?
I will look at the paperwork and we'll provide a clarity to that question, okay?
So you guys are very unique in the sense that not very many employers cover for their employees. So this is a great question that they'll follow up on for sure, because everywhere else, they're gonna, you will pay and then they might reimburse you. So something that we'll look at further clarification on, but yes, question.
Well, that brings up a question. If we're doing the pre-tax dollars and we want to set aside money for healthcare, the tax deductible, we need to know how much we're paying out of pocket, so we can put that in our figures. Does everybody know what I'm talking about? What's that plan called? The 125. You can set aside money that's pre-tax dollars that goes for health. Yeah.
Like a health savings.
Well, we have to know those figures in advance in order to be able to make that deduction.
That would be directed at Solano. At the CalPERS level, we bill the district for the total premium, and then if they're paying 100%, then they have to figure that out with you.
So we have to project how much our deductible is going to be, because that's also pre-tax dollars, isn't it? Can't we count that? You can't count deductibles?
HSA.
But that's for healthcare. It doesn't count?
The next question, I'm going to move to make sure that everyone has an opportunity to talk with the individual plan sponsors. My husband and I are full-time faculty at SCC. We want to know the advantages and disadvantages of enrolling as a family, no dependents or as individuals.
The disadvantages would be if you both did single and you had to pay 100% or whatever out of pocket, you'd both pay the single rate. But if you put yourselves on a family or a two-party plan, it's not the same as single times two. It's a little bit less than that. But other than that, everything is the same.
Is that HMO and PPO?
As far as the rates,
Yeah.
do you have a rate sheet? If you multiply the single rate times two, it comes out to be less than the two-party in most cases. I don't have one in front of me, but it should be like that. But there aren't any other disadvantages or advantages to getting a single party versus a family.
Okay. Domestic partner, same sex, or one must be at least 62 and receiving Social Security retirement benefits. Does this mean a man and a woman can be registered as a domestic partner? And what about pre-existing conditions?
Pre-existing conditions are not an issue with Calpers. Whatever you have coming into the program, you will be treated for it. We will not discriminate against you based on any pre-existing conditions. Regarding domestic partnerships, the law is that if they're same sex, one party has to be at least 62 or over, and the other one has to be at least 18. This is because people who are opposite sex have the opportunity to get married. And if they don't want to get married and want a domestic partnership, then one party has to be at least 18 and the other one has to be at least over 62. For domestic partnerships, as long as you have your certificate from the Secretary of State's office, you can enroll in our plans. And if you are married to someone else of the same sex as you, you can turn in your marriage certificate as well and enroll them on your plan.
The next question. My husband is also a state employee, but I carry him on my plan here at the college. Is the co-ban he is getting from his employer remains the same? Again, the co-benefit, I do believe that is.
Does that mean he gets money in lieu of declining coverage?
Again, the question is, it says co-ben. I think it's co-benefit. The person is no longer in the room who asked this question.
Like a flex cash type of thing for not taking help?
Here you go.
Okay, so if you are working for the state, yes, they give you back money if you don't enroll in their health. So if that person did stay on the health plan for Solano and didn't enroll through the state, they would still get it back. That doesn't affect this.
Okay, we have a question about compensation for not enrolling. The university still offers $125 for not taking the medical, or you can set up a tax shelter, a TSA, in place of not receiving the medical through the college. The next question is dual coverage with FEHBP and co-pays. What? Yeah, you can see that. It's number 2.
I have no idea what FEHBP is.
Yes, sir. Federal Employees Health Benefit Plan.
I doubt that they're a member of the Calpers Health Benefits Program, so you can stay with that dual coverage. For instance, my husband is an active duty firefighter for the Air Force. He is in TRICARE. I don't get Calpers Health Benefits, but if for some reason I did, and then the US government decided that TRICARE was gonna go under the Calpers Health Benefits Program, I would need to decide if I wanted to be with Calpers on my own or be under TRICARE under Calpers. But since it's not like that, I can be under his and I can be under mine. We just don't want Calpers here and Calpers here with 2 subscribers claiming each other as dependents because it creates excessive premiums for the district. Okay. The copays would be the same as whatever is on the sheet for the plan that you pick. Even if you have Kaiser through both of them?
The question was if you were duly covered legally, so non-CalPERS and CalPERS about copays, in many instances, they'd be zeroed out. So, yeah. But sometimes it all depends on the plan that they're on. So that's something you can call member services on and ask.
The next question is Part B Medicare required after you retire?
Yes.
Well, that was the easiest answer I've heard.
If you're
all
eligible
day.
for Medicare Part A and Part B, you have to enroll, and then you pick one of the Calpers Medicare programs at the bottom of that rate sheet, and then you don't enroll in Part D because the prescription benefit in our Medicare plans is comparable, if not better, than what is provided through Medicare.
The next question, PERS portable for services outside the 49 states. Do you have the same coverage, 80-20, particularly Hawaii, Alaska, and Puerto Rico?
Yes, yes. And as I mentioned, virtually all the people in the Calpers system who live permanently out of the country, they have the PERS choice plan. By the way, I see a safety gentleman in the back. You would be eligible for the PORAC plan. And I can talk to you one-on-one on that, because I manage that as well.
The next question, if I select Blue Shield Advantage Access Plus, then all the current doctors that I see currently under Hill's physician will remain the same? Or is there a possibility they will change?
So the plan is actually called Blue Shield Access Plus. There's no such thing as Blue Shield Advantage, even though I know some of those forms say that. Blue Shield offers two plans, Blue Shield Access Plus and Blue Shield Net Value. And yes, the network is going to be the same. So if that Hill Physicians network is here in Solano County or just anywhere in East Bay, it should be the same.
I am on the last question. If you have any questions, this is the time. Otherwise, you will have to save your questions for the individual plan sponsors or Calpers at the end of this presentation. If you need cards, I will come around and hand out additional cards. The last question I have in my hand is, my husband has Kaiser through his work, not Calpers. How will this affect Calpers Kaiser at Solano?
Husband has Kaiser through work, not Calpers. How that affect Kaiser Okay, so you could, because the husband isn't under Calpers, you can cover each other dually. So you can cover, this lady can cover her husband, and the husband can cover her. So the same thing as over here as far as the double coverage. It doesn't affect anything. It's a financial decision. All I can say is that Calpers is a very rich plan. As far as rich benefits, it's a second to none. So come see me, this person. I would love to help you kind of think through that.
Now, if I really wanted to nail down thing by thing what differences there might be in the coverage between the Kaiser plan that we currently have and the Calpers Kaiser, that's something I should call member services, is that it?
You can, that might be quite cumbersome. The best way to compare any plan, whether it's our own or others, is through an evidence of coverage. And you can get those in a PDF form at kp.org/Calpers. And without logging in for anyone, you can go there and under My Plans, you can see evidence of coverage. That goes over every single benefit, what covers, what it doesn't cover, and you can compare that against any plan, whether it's ours or other carriers. You have a quick comment on that? Does that make sense to you guys as far as how? So kp.org/Calpers, and then Blue Shields. Do you have one as well? Oh. Yeah. Oh, sorry. Okay.
Actually, if you go to the Calpers website, everything's on there, the evidence of coverages. But also, if you picked up that health benefit summary guide, it gives you a quick overview of what's covered and what's not covered. Page 14 of all three plans, the Kaiser plan, the Blue Shield plan, and the Anthem PPO plans. And then you can compare it to your other ones. Because really, that evidence of coverage booklet is going to give you in-depth, like durable, medical equipment, prosthesis. I mean, it's gonna go into real depth, so. Okay, then fantastic. That's what you should do then. Go to the Calpers website and you can download each PDF of the evidence of coverage booklets, and it could be abbreviated as EOC, and then you can do searches, which is fantastic.
Abbreviated as how?
EOC, evidence of coverage. And that's at www.calpers.ca.gov under forms and publications.
So a quick question regarding PERS choice and the cost. You may have said this, Mark, but was this the cost of a non-preferred provider? What happens then if you want to use somebody who's not preferred?
If you want to go to a non-preferred provider, the benefit level drops quite a bit. The rule of thumb is 60-40 coverage rather than 80-20, but it could even be lower than that depending on how much above reasonable customer they charge. Right. And you do not get that $3,000 limit doesn't apply. There's a lot of disincentives to go non-participating. Yeah.
Great, thanks.
The next question that we have is if you can please define what a two-party versus a family, how is that defined for Calpers? Oh, I'll wait till she finished answering his question.
Two-party is two individuals. It could be an adult and a child. And then family is a subscriber and two or more. It could be two children, or it could be a spouse and a child, right?
Yeah, and it could be a couple and more than however many, like 3 or 4 or 5 children. There's no maximum on that.
Thank you for that clarification. I'll bring the mic over in just 1 second. What is the coverage for a child coverage 18 but not yet attained 26 and employed?
If they don't want health through their employer, you can add them on yours. But when they turn 26, they're going to fall off your coverage. Unless they're certified disabled, in which case they're covered for as long as you want them on there, as long as they were certified disabled before age 26.
Real quick, same thing along that same question. But if the individual is living in my house, like say I have a dependent, and she's 21 going to college and working full time, and she does not have health coverage, she's not getting it through her, so she is still on my plan, and that's good, and that still holds true.
Yeah, she's covered as long as you want her on there. Even if she moves out and gets married and she's under 26, she's covered. You just can't cover her spouse or her child, but she's covered.
I have one more question on the Medicare required for when you retire. My other plan does not require that we go into Medicare. How would that affect this? I'd have to drop this one at that time? Drop Calpers?
Drop Calpers for the other Medicare plan?
Yeah, if I don't want Medicare.
If you don't want to, yeah, because you have to enroll in Part A and Part B in order to enroll in one of our Medicare plans. If you don't, you can't participate.
That's right after retirement or after 65?
65, as soon as you're eligible, yeah. Some people aren't eligible. They get letters saying that they're not, in which case they can remain in a basic plan. But if you are and you want coverage through Calpers, one of our Medicare plans, you have to enroll in Part A and Part B, not Part B.
Okay, we have one question on this side of the room. Okay, we have a clarification that says Solano Community College District health plans are grandfather plans, therefore any average dependents are currently employed cannot be eligible for any other employee-sponsored group health care coverage. Okay, thank you.
Okay, so that's actually a really good question that I did not cover when I was presenting. So if you're electing the Blue Shield HMO plan, and you already have a Blue Shield physician that you want to keep, with the new Calpers system, there's not going to be a way for your health benefits officer to enter your doctor of choice. So what's going to happen is Blue Shield is going to auto-assign you a physician with a group. When you receive your card, you're not going to freak out. You're going to call the member services number, and you're gonna let them know that that's not the correct doctor, that, you tell them which doctor you need, and then they'll reissue you cards with the correct information. Before, the old system did allow all our agencies to be able to key in the physician choice, but now the new system doesn't have that field, so Blue Shield has to auto-assign you a physician. When you get those cards, you'll call in, they'll change it for you, and you'll get the correct cards. Okay? Yes?
How long will that take? So if you're in the middle of something, how long will that take before you can go see your doctor that you've been seeing all along?
Okay, let me give you the mic so we can, okay.
How long will that change take? So if you're in the middle of seeing your physician and you need to go see that physician and you have no card, say what my coverage is, how long will that take?
Okay, so you're gonna be effective July 1st, and you're gonna receive your cards. Usually, it's within like 2 weeks before your effective date, even probably before then, because once we receive the enrollment forms, it takes about 10 days to get you your card. So you'll get it way before your effective date. So as soon as you get that card in the mail, you need to call in and get it retroactive. It'll be retro, essentially. So I'm assuming, unless you already have an appointment set for July 1st, and it could be that July 1, say you already called Blue Shield to get your doctors changed in the system, but you haven't received your insurance card yet. You could still go to that appointment and you can call member services, and they can actually call your doctor's office and give them the correct information, so that way you are able to be seen. Yes, 1 second. Oh.
Would it make a difference though if that other doctor is also in the network? Why would it matter?
So the question is, why would it matter if the doctor's still in the network? And do you mean like if you're keeping your old physician on your old plan?
Doctor, they send you a new doctor. Both are on the plan. You go see your old doctor. Why would it be a problem if you don't yet have your card?
So
they're in the network.
So normally the doctor's office wants to see your current plan card, so that way they can bill correctly, and that would be the issue essentially. So you're not going to probably have a problem seeing your physician because you should have your card. But in the event that one case out of 500 may not have their card, then we can call member services. And actually, I know that in other agencies, members will contact their HR office and they contact our priority team, and they do it right away, or Calpers, and they pretty much do it right away.
I want to take this opportunity to thank our invited guests for spending the whole day actually with us, answering our very detailed questions. They are available today until 5 in this room at their respective booths, so please take advantage and get all the information that you need to make this transition smoother for you. Out of respect for their time, and also to make sure that each one of us get time with the individual sponsors, I just want to ask everyone to join me in thanking our guests for joining us today. And thank you for being actively involved in this forum. Thank you.